Hi there, I'm Thomas Hartle, and with me today is Dr. Toby Bridgman, who is a naturopath here in Saskatoon, Saskatchewan. Toby has been my naturopath for a number of years here and has given me some help with the cancer treatment that I'm going through, but he is a wealth of knowledge on a number of different topics. Today we'll be talking about a few things that I find interesting, and hopefully Toby will tolerate some of my crazy ideas. And we'll see how this goes today. Toby, I guess maybe I will let you maybe tell people what it is that a naturopath does that's different from a regular medical doctor. So, for example, if I've got a cold or the flu or something, I know that I could go to my regular medical doctor, and there's not really anything that they can do for viruses. I know if I have, broken bones, I go to a hospital, but what exactly do people typically come to a naturopath for?
That's a really good question, Thomas, and I think a lot of naturopathic doctors actually struggle with that answering that question themselves, and I think oftentimes, most times, people don't really understand what a naturopathic doctor is. So I have my own sort of quick little speech that describes what it is that I do, and that's that I believe that naturopathic doctor is always asking, what's the nature of your illness? Why are you sick? Why do you have these exact symptoms? How did you become ill? And then we try to address those root causes. So it's not really a particular belief system but it's more like a system of medicine in which we're trying to understand the root cause of illness. And so if somebody were to come to me and say, I'm always getting sick and I don't know why, I would be asking questions around that. Why is your immune system reacting to things, or why does it seem like you're sick often? And then, trying to identify the root cause of that. Maybe you're not sleeping at all and your immune system can't catch up, or you're missing some critical parts of your nutrition, something like that. But in a lot of ways, naturopathic doctors are not all that different from medical doctors. We still look at, your blood work and take a look and see. Like, we try to make a diagnosis first. So we're looking at your blood work and imagery and doing physical exam and asking a lot of questions. And so when you ask me, back to your question at the beginning, who sees a naturopathic doctor? It's usually somebody who's chronically ill that comes to see me, or someone who's got a serious illness in which their quality of life has been impacted significantly, or in a case like yours where there's malignancy or stage 4 cancer as you have. There's often a lot of questions on how can we make the mainstream conventional regular treatments work the best that they can, and how can we avoid or minimize the side effects that are going to come from them. As naturopathic medicine is not against conventional cancer treatments, which some people might perceive that it is, but it's not.
Yeah.
It's like, what's the most simple thing that we can do to help somebody with cancer? And sometimes that might be surgery, chemotherapy, radiation. That those would be things that a naturopathic doctor would encourage if living longer and quality of life are important to the patient, which usually they are. So it's, yeah. Anyways, I'm rambling now.
No. So I guess it would be probably fair to say that for people who don't really understand what a naturopathic doctor can bring to the table, it isn't a question of a person choosing naturopathic medicine over the allopathic, conventional medicine. If I'm understanding you correctly, then the naturopathic is something that seeks to work in conjunction with traditional therapies to look for what would be the most effective path for that particular condition. Is that
always? The goal is always what's best for the patient and what fits with the patient's values.
Mm-hmm.
Most people don't want to just walk away from conventional medicine. I find most patients aren't that way, though some people will come to me and say, it's my belief that I won't take any pharmaceutical medication and I won't have any surgeries, and that's my belief.
Mm-hmm.
And my medical doctors are saying that they can't help me with those views and values, and what can we do? And oftentimes I'll do the same thing that their medical doctor would say, is like, actually, the evidence shows that you probably should do those things.
Mm-hmm.
But if we can just make note of the fact that you refuse that, I can go through other things. But we always talk about the pros and cons of each medicine in each direction. But mostly it's not a choice between. It's trying to work with, or minimize medications, or help your family doctor help you, or empowering the patient to understand their illness so they can help their medical doctor know what they may, what they might be able to do to get better results.
So in naturopathic medicine, I guess before I had a chance to talk to you, my perception of what that is would be, a substitution of, herbs and things in place of your conventional prescriptions. And since I have had a chance to talk with you and experience some of the naturopathic ways, to me it seems more of a way of optimizing the health of your body with diet and nutrition and all of the things that we should be doing,
right,
in order to bring our body to the best state that it can be prior to the introduction of other therapies. So would that be an accurate statement?
It's a very accurate statement, and I think you're right. A lot of you kind of smiled there when you're talking about optimizing health. You're right. Most patients actually already know a lot about what they need to do to improve their state of health. And some of that stuff's really simple. A lot of the big stuff's actually really simple. And then, of course, there's tons of little tiny different things that maybe naturopathic doctors are more expert at, extra stuff that you can bring to the table. But yeah, you always want to address the big stuff. I think one of the most interesting things that I actually feel that you've taught me a little bit in an area specific to around cancer support with chemotherapy, is when you told me that you were eating basically a carnivore diet with very low fiber and lots of protein and fat, lots of meat and fish, seafood, that kind of thing. And that's interesting, of course, because a lot of patients with cancer who come to see naturopathic doctors will expect or even want to be put on an extreme diet, which is often all fruits and vegetables, raw foods, avoiding any animal proteins, a very sort of idealistic type, what one might imagine is a diet that would be pure and help you become maybe cancer-free or something. Again, that's a belief on the behalf of the patient, not necessarily always on the side of the naturopathic doctor treating them. But it's interesting, you're a very researched and intelligent person, and you do experiments on yourself, and you have been for years. And it was interesting to me that you experimented with having very low fiber, which of course fiber can scrape and scratch the bowel.
Yes.
And the bowel is one of the primary places that will be harmed when you're taking chemotherapeutic agents that are targeted towards tissues of the bowel.
Yes.
And so giving the bowel less to deal with, that was really interesting to me, because sometimes even I've even found myself getting into that, giving patients what they're always asking for.
Yeah.
And that would be an example. I feel like that's a very naturopathic line of thought. Like, you're getting these severe symptoms from chemotherapy. How can you minimize them? How can you stabilize your energy and your mood? And a high protein, high fat diet with low fiber is perfect for that.
Yeah, that seems to be something that has been really successful for me, especially on chemo days. I guess for anybody who is not familiar with what I have going on, I am a stage 4 cancer survivor, is what I would call myself. So far, so good. I have been fighting cancer since 2016. So I'm just coming up on my 5-year anniversary, actually. And one of the things that I have found when I'm under chemotherapy, it tends to make my intestines feel what I would call sunburnt. So anytime I have food that has a texture to it, fiber, vegetables, things like that, it has a lot more scrapey edges and corners. So I found that by switching to something that has no fiber whatsoever, which in my case would be a carnivore diet, particularly on chemo days, I relax that. The farther away from chemo that I get, the more normal my diet can become comfortably. Mm-hmm. But if I use a strictly carnivore diet, high-fat diet, during my chemo days, then there is not that same level of irritation, and I find my intestines have a much faster recovery rate following that. Mm-hmm. So where I would have a lot of very active intestinal issues for pretty much the week following chemotherapy, I have lessened the length of time where I'm in real discomfort to just a few days now.
Right, that's interesting. So, and usually when a patient gets, your chemo day has been Friday, every second Friday recently.
Friday, Saturday, Sunday.
Friday, Saturday, Sunday. The symptoms usually of GI upset usually start to occur, is it about 24 hours later, or is it the same day?
So for me, with the type of chemo that I'm on, chemo day 1 is a lot of abdominal pain. Chemo day 2, my intestines shut down completely. And chemo day 3, things start to move again. Day 3 is usually a pretty uncomfortable day for me. Mm-hmm. That's probably the maximum amount of tenderness for me. The day after chemo and probably the next 2 to 3 can be extremely active. So those are the days when my body is just trying to get rid of whatever is in there.
Because it's irritated. And that's a reflex. Yeah. Whenever the gut feels that it's been injured or harmed, it'll always try to flush itself out.
Yes.
It doesn't know what the problem is, but it knows that there's something there, and it'll try to pump water in and
flush it through.
And flush everything through. So you start your you start your carnivore diet on which day? So you're beginning your 3 days of chemo on a Friday.
So I will start my carnivore diet on the Thursday before. So I want the contents of my intestines to be nothing with corners or textures or anything.
So the day before, Thursday, the day before.
Yes.
Okay.
So I will start the carnivore diet on Thursday so that I know that what I have in me is something that's going to be compatible with the days when I have my tenderness. I will continue that carnivore diet and fat shakes. Fat shakes are another thing that I can tolerate well.
Right.
For anybody who hasn't seen my fat shake video, that is an alternative to what people use instead of Ensure or Boost. I do not use Ensure and Boost because those are, the majority of your calories in those come from sugar. And anybody who has cancer and done a little bit of research will know that cancer loves sugar. So if you have a diet with sugar in it, then I believe that that's something that really helps the cancer quite a bit. And I don't want to do anything that helps the cancer. Mm-hmm. I'm selfish like that. So a fat shake is low sugar, high fat. I have a no sugar protein powder. I use whipping cream in it. I use whole milk in it as a carrier. Ice, 1 banana. I use a nut butter. So like a hazelnut or almond, something that's going to be healthy without carbohydrates. And you mix that up in a blender. We've got about a cup of whipping cream in there and banana. Let's see my ingredients. I'm going to do this again for ingredients.
Right, you do put some banana in there?
Yeah, I do.
Right. So there are some carbs in there, but the majority of the calories is coming from fat and protein. And when you mix fat and protein together with some carbs, usually the sugar will come in very slowly into your bloodstream, which just to talk about, you mentioned sugar earlier.
Yes.
And I'm not trying to split hairs or anything, but I'm a middle road. Just so everybody knows, I'm a bit of a middle road naturopath. I'm not extreme, so I feel like it's more like having your blood sugar level level all the time is a goal to aim for. So you can have carbs, but just timing is also really important.
Yeah. My view on the carbs. So I call my diet heavy keto, but not a pure keto. I will eat things that have carbohydrates in them, but not anything that is a refined sugar. So if it's the natural sugar found in a fruit, then I consider that to be okay because of the extra enzymes and things that are in it to balance against something that is refined sugar, which is like rocket fuel.
Right.
So, the amount of carbohydrate you find in a banana or a piece of fruit, very, very different from the sugar that you find in a chocolate bar or, one of those protein bars or something like that.
Right. Okay, I understand. Yeah. Now, and so when you do your carnivore type diet, have you found at any point you've gone into ketosis, or have you ever found that you've got ketones? Have you ever checked to see if you have ketones in your urine?
I have honestly never checked.
That's interesting. Yeah, it's really interesting because the body can adapt, and when you first start eating the way you just described, it can be really challenging.
Yeah.
When all of the machinery in your cells is basically designed to work with carbohydrates, and then you give it nothing but fat and protein, a person can feel ill. Did you feel ill at all when you first tried that?
One of the advantages of being on chemotherapy on a regular basis is any other feelings of ill that you might have just get whitewashed entirely beneath the chemo.
Right. So yeah.
It's entirely possible that I have had the flu or COVID or, any number of things and just not noticed. It's possible. I don't know. But my wife does also eat more on the keto side, and she has commented when she is transitioning from regular diet to pure keto that she will have a bit of what she calls the keto flu for a day or two.
Yeah.
While her body makes that transition between processing carbohydrates to having your liver process fats into ketones.
And your cells to learn how to use the ketones.
Yes.
That does take some time. I did this. I did the ketogenic diet more strictly than you're describing a couple of years ago, and it was quite remarkable. I lost about 15 pounds in less than a month, which was quite remarkable. But I felt like I had a flu. I actually did feel like I had a flu. I was able to manage it a little bit with getting a little bit of extra potassium in my water.
Yep.
But I was quite sick. But after that 2-week period, I've actually never felt so stable as when I was on that diet. But yeah, I think it's important for people to know. Stable, I mean energy-wise.
Yes.
But I would always let people know that if you're going to switch to a really low carb diet, as you're describing, just be prepared that you might feel off. You're quite resilient. Yeah, so it's important just to know that you might feel a bit off and maybe practice ahead of time if you're doing a low carb diet quite suddenly. But yeah, I think it's a really genius idea, because if you've got less time where you're down and sick, You've got more time. If you can heal your bowels quickly because you've thought about how they work, you've minimized the amount of irritation to your bowel, you're getting the calories you need while you're getting chemotherapy, your recovery time is quicker, which means you can gain your weight back sooner, and your body can have the resources and your immune system can recover, and your body can get back to a more healthy state sooner. So the side effect, the downside of having chemotherapy is minimized by just a simple intervention like what you described.
Yeah. And that is exactly the reason why I'm doing it that way, and that's exactly the results that I've been getting out of it. Of course, it's not the only thing that I'm doing, but that for me has been something that has had a really good impact on my overall health.
And you've done exceptionally well. What other things do you feel that you're doing, Thomas, that are having the biggest impact? Like what are the
the one that I have been doing for the past year that I think is probably the biggest impact, and the change that I made to what I'm doing about a year ago was the addition of turkey tail mushrooms into my diet. So specifically what that is, it's not just the turkey tail mushrooms, it's turkey tail extract. So a turkey tail mushroom is a type of mushroom that grows in the old growth forests, so it's would grow on hardwood typically, and it's not an edible mushroom. So they take the turkey tail mushrooms, they grind them, they boil them in water to extract whatever is in them, and they boil the water down and concentrate that into a powder, which then gets put into, I buy the powder in bulk, and I make my own 00 capsules out of that.
Right, so that's the oligosaccharides, those complicated sugars that come out of the out of those mushrooms, is that right?
Sugars, the polyphenols, the flavonoids, there's a whole host of ingredients that are extracted out of the mushroom in that process.
And you get a powder that's basically that isolate that's come from those mushrooms.
Exactly so.
Okay.
So I've found a place that sells it in 500-gram packages, and for anybody who is interested in the process, you can buy a machine that will accept the 00 capsules. So that's just your standard capsule that holds 500 milligrams, so half a gram. A 500-gram package of that is enough to make roughly 1,000 capsules.
Right.
And the dosage that I take is another factor that's really important.
And what is that? What is that dose? What do you feel is a good dose?
So I did some looking into the reason why I take these. I guess off the bat, why would I even bother taking those? I don't just pick things randomly off of the shelf and try them out. What I do is I go to a place called PubMed, which is an internet site which is publicly accessible medical research papers.
Right. So you look at all the published medical papers from PubMed.
Yes.
Review those, and then you're looking for things that come up the most, or things that show the most effect.
Most effect. So I will look at particular studies that are targeted at my type of cancer for a starting point. And I will look at the types of research that have shown some clinical positive impact on that, either in vitro, which would be testing things in Petri dishes and test tubes, or in vivo, where they actually move to lab animals and in some cases clinical trials with people. In my particular instance with the turkey tail mushrooms, these are something that has been shown to have an effect both in vitro and in human clinical trials, which they have done at Johns Hopkins.
Right.
At Johns Hopkins, they did a study where most of the participants, I believe, were breast cancer and colon cancer. And they gave their patients 8 capsules a day, which would be 4 grams. In their particular study, they gave 4 capsules in the morning, 4 capsules in the evening. Mm-hmm. So it would have a sustained dose kind of over the course of the day. But they did find in that study that the effects were dose dependent. So
right, so the more you took, the better the outcome. Mm-hmm.
So for my case, because turkey tail mushroom happens to really not have any detectable side effects that I can find at all. I take, on chemo days, 8 capsules in the morning and 8 capsules at night. So my dose would be 4 grams in the morning and 4 grams in the evening.
Right.
On my non-chemo days, I reduce that dose to just the 8 capsules a day.
Right.
Now, there isn't really any particular reason why I would have to, but I have found that I've been getting good results at that dosage.
Yeah. So why change?
Yes.
But so you've been getting good results. So since you say you've been getting good results. So since you started, your chemotherapy regimen hasn't changed particularly.
Yes.
But your outcomes, I know you've been doing well.
Yes.
But what did you notice when you started taking turkey tail at high dose like that?
Yes.
And this is, so there's a lot of criticism of using natural medicines and naturopathic doctors and natural medicine and treating cancer patients or helping cancer patients because, looking at a few studies,
yep.
Some people will argue there's not enough evidence to rely on.
Yes.
And everybody has different experiences with everything, of course.
Absolutely.
So just to be clear, we're not making any kind of claim that everybody would have the same
This
outcomes.
No.
But
it's not magic.
Yeah. But what have you noticed, Thomas? Because it is quite encouraging.
Yeah. So from my own personal experience, and bear in mind, I am absolutely undergoing the standard traditional chemotherapy. And my doctors assure me that the chemotherapy will not cure my cancer. So stage 4 cancer, there isn't a talk of cure at any point in this. So what we're talking about is maintaining my symptoms, quality of life, and any improvement that I can get out of that. In last August, so August of 2019, I guess to be specific, I had surgery. They discovered that my cancer had grown significantly over the course of the couple of years since my previous surgery and treatments. And so we started back on chemotherapy after I recovered from the surgery. At that time, I had CT scans that showed 2 of the many tumors that I have actually are visible on a CT scan. One of those tumors was 34 millimeters in size, so that's what, golf ball? 3.5 centimeters, so about golf ball sized. And the other one was 24 millimeters. So 34 and 25 millimeters. Over the course of months, I have seen a decrease in the size of those 2 tumors. So the ones that we can see, one reduced down to 8 millimeters on my prior scan, and the other one was 9 millimeters on my prior scan.
Right.
I just had a scan a couple of weeks ago, and I have found that the 9 millimeter is no longer visible. Mm-hmm. So I guess my results that I have had is the combination of chemotherapy and the turkey tail mushrooms, which is one of the things that I am doing, seems to have a positive effect on reducing the size of the tumors. Likewise, experientially, I have had a reduction in the amount of abdominal discomfort that I have. Mm-hmm. I have found more regulation in the function of my bowels. So we have gone from a state where I can't be anywhere out of sight of a bathroom,
right,
to where I have with some planning, been able to go on a car trip and things like that. So
That's fantastic.
I've actually recovered a lot of my freedom and mobility, reduced the amount of discomfort that I have from my symptoms, and I have had some positive impact on the cancer itself.
That's amazing, Thomas. It's fantastic. So, you know, it's interesting, like there is quite a bit of research on, as far as naturopathic, you know, natural medicines go, in medicinal mushrooms and cancer. And it's often recommended. But when we look at the products that, you know, in our clinic, I have to, when somebody buys a product from me, from our clinic, it has to be, I need to know that what I'm selling them has exactly what I'm telling them is in it. So we get really high grade, triple tested, you know, naturopathic supplements, and we use those with our patients. But when we start talking about the doses that you're talking about, via like a one single jar or bottle of capsules won't last all that long at 8 capsules a day or more, 16 capsules a day. So, and I think here you've also come up, or I don't know in this case if you have, but you've come up with some ways to do this affordably. Not everybody is able to afford everything. And, you know, this is a medicine that might help, but at the doses you're talking about and for the many months that you've been taking it, that the cost can be significant. And I think a lot of people will be interested in your solutions on that.
Yeah. So I have, and of course I totally encourage people to find the best quality medicine that is within your affordable range. I have looked at a number of things that are probably outside of the box a little bit, I think. Probably the least out of the box is what I do with my turkey tail mushrooms in buying them from bulk. And of course, not a promotional video in any way. I happen to buy my products from a place called purebulk.com.
Okay.
And
they sell bulk.
They sell bulk supplements.
Supplements, and that they have a wide range of supplements that you can choose from. It's not just turkey tail
they happen
mushroom.
to be a retail online location where you can buy turkey tail in bulk, vitamin C in bulk, whatever selection of vitamins you might be looking for. There's a good chance that they carry it in big packages. The downside is you do have to package it yourself. So you get a
I just want to stop you just for a second, just in case. Just so everyone knows who's watching this video that it's probably good. I'm not advising people to go and make their own medicines at home and experiment. As a naturopathic doctor, I'm not recommending that. I just think people will be interested in what Thomas has found works for him.
That is a me thing. That is not a naturopathic thing. That's a me thing.
Anyway, sorry to interrupt.
Nope, all good. So I look for ways that I can reduce the cost of what I am doing by doing the labor component. So another example of that would be the lion's mane mushrooms that I use.
Right.
So for my cancer treatment, I did 12 rounds of a type of chemotherapy called Folfox, and the ox part of Folfox is oxyplatin, which is a platinum-based medicine that unfortunately has a side effect of bonding to nerves and causing things like neuropathy and brain fuzziness and a number of other rather undesirable side effects. Neuropathy is where you lose the feeling in your fingers and toes. So
and you get that chemo brain, forgetfulness and having trouble remembering things. And
so a general, very profound impact on you neurologically. And my research again at PubMed was showing me some of the studies that they did out of Japan, where they were using a lion's mane mushroom as a supplement to treat dementia and Alzheimer's patients.
And those studies showed that it was effective.
and it was showing that it was effective. They were using doses in the range of about 4 to 8 grams a day.
Which is a really high dose. That's a lot of capsules.
Seems like a very high dose, a lot of capsules. Now, if you purchase those in pre-made capsule form, I have found they probably run you around, say, $30 to $40 for 90 to 100 capsule range. That seems about average. What I have done as an alternative to that is to look at places like Asian markets.
Right. So you go into an Asian market and you buy, you just go in there and you buy whole mushrooms, or?
Yeah. So what I have found in the Asian markets, I'll grab what I have here.
Right.
So these would be an example of commercially produced capsules. They contain roughly 500 milligrams. That's the regular dose in a 00 capsule. This is a quality product. I like it. It works well. Available in many places. But it contains lion's mane mushroom powder.
And that's about 500 milligrams
per capsule.
Per capsule. Okay.
This is actual dried lion's mane mushrooms. So this is what is inside of here. So where the capsules themselves, around that $30 to $40 range for 90 capsules, this is 150 grams worth of dried lion's mane mushrooms. So this is enough to produce roughly 300 capsules worth. And at Asian market, you can pick one of these up for, say, around $6. Now, the cool part about this is that you don't even have to put this into capsules if you don't want to. You can literally take this, chop it up, throw it in your a coffee grinder, for example, to powder it. These are also a culinary mushroom.
Do they have a strong flavor, or is it?
These are literally just mushroom flavored. So you can grab a couple of teaspoons of this powder, weigh it out, if you got a little digital scale, and you can literally just sprinkle this on your food that you are eating, and you will get your 4 to 8 grams of mushrooms.
Right, and it just goes down easily as a food.
As a food.
So the cost savings is interesting here. You're saying it's $6 for 150 grams.
Yes.
This is about 45 grams so it's about $1 a gram.
Yes.
And then in your package there, $6 for 150 grams. I don't know what the math is there, but it seems
we'll
seems
put the
pretty
math
good.
Over here.
We got and so that's to me that's interesting, because you start taking, we talked about turkey tail, how much that costs. We're talking about this supplement, how much it costs. Not everybody who's getting the kind of treatments you're getting is able to work full time, so income is changed for a lot of people.
Yes.
So trying to find things in a cost-effective way is important, and it's a challenge that needs solutions. And these things are quite safe. I mean, this is a culinary mushroom we're talking about here. Completely. We're not talking about some herb that has.
If you take this much, it's okay, and if you take a little bit more, it's not okay.
What we call a broad therapeutic window.
Yes.
So some medicines have a much more narrow therapeutic window, but this one's got a nice, real safe aspect to it. So it's already a food. And so, and $6 for such a large amount, and the studies are clear that it does help the nervous system. But again, you've been getting FolFox treatments. The schedule has been similar. You looked for a solution for neuropathy. How did it go? What are the results? Have you noticed a change?
So to give you an idea of the extent of the neuropathy that I had, I was actually getting to the point where I was having difficulty doing up buttons and doing fine motor control.
Right, you didn't have control over the longest nerves that go to your fingers and maybe your feet?
Exactly.
Right.
Yep.
Okay.
If I was having a shower, I would have to have one hand on the wall to make sure that I wouldn't lose my balance.
Oh, so it was more than that. Was that because your legs were weak, or did you feel like vertigo, dizziness?
Couldn't feel the pressure in my feet to be able to tell whether I was leaning in one direction or not.
Mm-hmm.
So I had a lot of difficulty with balance and fine motor control.
Mm-hmm. That's a little bit dangerous.
Yeah.
Falling out of the bathtub
wouldn't be good.
Yeah.
So that was persistent for about a year following my chemotherapy, just for scales of things.
And it held. It found a plateau and it just stayed there.
Yes, and unfortunately, my oncologist told me that if the feeling didn't come back after about a year following the end of my Folfox treatments, then it probably wouldn't come back.
Right.
So after that year, I decided that I really had to do something about it because my quality of life was definitely being impacted by that. So I found the study and I started taking the lion's mane mushrooms on the dose that they were using in the study,
which again was
the 4 to 8 gram range. And these mushrooms have what they call a neurogenic property. So that means they stimulate the growth of nerve cells. So there's a couple of things that are important when we're talking about the neurological stuff. So there's neurogenic and there is neuroplasticity. Those are two things. These help a little bit with the plasticity, but these are more focused on the neurogenic. So if you can stimulate the growth of the new nerves, then I gradually, over the course of, say, 6 months to a year, because nerves grow slow, I had a return in the sensation in my fingers and toes.
This is while getting...
That is after my Folfox.
Okay, so you stopped Folfox.
Yeah. So I've actually had about a 2-year break in chemotherapy.
So, and your oncologist had told you that you wouldn't get that back because it had been such a long time that you'd had the damage.
Yes.
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 And they have quite a bit of experience in that area.
They do.
So again, that's quite remarkable.
Again, it's not magic. It's, and everybody's results will probably vary, but this is something that has had some good clinical studies done on it to say that there are many people who have this positive effect. Now, probably important to note that if you read those studies in Japan, they found that a lot of the benefits that some of their dementia and Alzheimer's patients were having on that were present while they were taking the mushrooms, and they did see a continued degeneration when they discontinued taking them. So it's something that, if you have a more serious neurological condition, you might want to continue.
And just stay on it.
But I mean, it's a culinary mushroom. It has literally no side effects that I can detect. If there is, I have not found them.
Well, it sounds like a medicine that'd be a great asset to a lot of patients.
I think so.
Not just people who are going through chemotherapy, who've been through chemotherapy, but also increasing numbers of people with dementia these days.
Even if you don't have dementia, this is something that can help with your mental acuity. So, if you find you're just not feeling quite as on point as you are some days, then taking something like this that will complement your neurology will probably over the course of time help you feel more on point.
Right. So your cognition might improve. How long do you think that it might take to see? Like, did you notice a change in the
clarity
of mind and that?
Absolutely. So for myself, I probably started to notice the effects of that after I had taken it for about a month.
Okay.
So this isn't something that you should expect to just take a pill and
Right.
everything changes. This is, neurogenesis requires time for things to happen.
Mm-hmm.
So patience and consistency is
Mm-hmm.
something that is important, I guess, in all things health-wise.
Yeah. So you might want to do that for maybe 3 months or something like that, and maybe check and see how you're feeling. Sometimes when somebody's frustrated because they can't use their hands, they've lost their dexterity, if they get 50% back, they're still frustrated because they can't, it might be that they can't paint or type, and so they feel they've made no progress. I have noticed that if you actually test the patient, you'll say, hey, there's been a big change.
Yes.
But they're not happy at all because they actually can't do the tasks that they're hoping to get back. So giving something, definitely taking measurements of some kind along the way, whether it's for cognition or dexterity, would be
Definitely.
probably worth doing so that you know if it's actually working.
Yes.
Before you quit.
Yes.
Mm-hmm.
And in terms of the tests for things like that, I'm not too sure what would be the ideal tests for it, but I completely agree that it would be a great idea to measure prior to starting and at some interval while you are in the process.
Mm-hmm.
That is definitely something that I have found helpful in my own personal treatment of my cancer and things. I have a number of measures that I use to determine whether something that I'm doing has a good effect, no effect, a negative effect. And the treatments that I choose to supplement my conventional therapy with are vetted through that process.
Okay, so is that like keeping a log? You keep a log, or
I do, and I would encourage anybody who's got cancer or a serious illness like that to start a log or a symptom diary, because that's something that has been really helpful, I think, when I talk to my oncologist or my naturopath or my family doctor. When you go to see your doctor, it's one of those ones like you take your car to the mechanic and
right.
the car's running fine when you get there. Lots of people get to their medical practitioner and find that they're feeling fine or their symptoms are not in effect, or they can't think of what all the symptoms were that were the reason they made the appointment in the first place. So for myself, before I go to an appointment, I try to keep a log and I try to make a diary and list of concerns that I want to take to my medical practitioner.
Mm-hmm.
And I find that the more comprehensive of a picture I can present to my medical professional, the better able to provide me with a good information. Mm-hmm. They get a better idea of the whole picture that's happening. Mm-hmm. If I came to you and I said I had a stomach ache, that would give you a certain group of things that it could be. But if I give you, I have a stomach ache and my muscles are cramping and I've got, a headache,
whatever, a headache,
whatever it is,
and
the list of symptoms is going to give you a more comprehensive idea mm-hmm. of what's really going on, as opposed to I just ate too much candy.
Mm-hmm. Well, with our social system that we have here, and that's the only system I know. But when you see your medical doctor, they're under a little bit of pressure. I think they have about 10 minutes or so to see you and figure out a plan. Mm-hmm. And so if you're coming in with basically a log of any kind, or charts and graphs, and you're able to show them, this is where I was, this is where I am now. Mm-hmm. These are all the symptoms that are bothering me the most. These are the medicines that I'm on and when I started them, and it makes it a lot easier for the doctor to catch up to you and then help you with what get what you need. When people come to me, as you've just described, I had a patient come to me last week, and she had 10 years of blood work, every single indices was graphed out. So every single point, every aspect of measurement on her blood work was on a graph. And then she had her symptoms on a timeline, and another person that she's related to on a similar timeline. I have to say it was profound, the speed at which I was able to come to a useful plan with that patient was, instead of spending an hour and a half trying to ask all the right questions, this person, I mean, this is someone who's a lot like you are, very organized and informed, but it did make my job really easy. And of course, we ended up sending her to her family doctor with some ideas on what might have been missed.
Yeah.
I would have never been able to do that work even in the full hour and a half that I would normally take with a patient on a first visit, without her doing that, being that organized. And I expect it's the same with any illness.
I would think so. So I guess along those lines, if I was just starting out and I didn't have my list of things that I keep track of and such, what would you say would be the most useful things that a patient could keep track of to bring to their medical practitioners that would have, a real benefit to the diagnoses? Are there any things that they could keep track of or diarize in some way that would make your job easier and more effective?
Yeah, so, and that this would be true with seeing a naturopathic doctor, any healthcare practitioner. I would always make sure that you've got all of your blood work, imagery, pathology reports in a binder or folder on a file that you can easily access. It's organized. It's the first thing that you want to have, so that you can quickly reference. Sometimes mistakes get made, things are overlooked, but if you're informed and you have everything in front of you, and your doctor might make a mistake, they might think your immune counts are good, but they're not. It's really important to have all of your blood work and all of your imagery and all of the information that's in a hard file in your hands. And now this is, I guess I'm thinking a little bit about cancer, but in general, what makes you feel better? What makes you feel worse? Are you better at night? Is your sleep changed? Are you worse in the morning? Are you better in the afternoon? Are you worse in the afternoon? Where your symptoms are changing and which symptoms are changing and when they're changing, anything like that. When I eat this kind of food, this changes, or at this time of the month, my headaches are worse, or this many days after a treatment, I always have this symptom. If you can write all that out in a concise point form kind of way, whatever you're looking for, I'm convinced that you will get better care. You'll always get better care. It's not just that it makes it easier for the doctor or the healthcare practitioner who's seeing you, but it also shows them that you're engaged and informed and empowered in your own health. And when someone shows that they're trying really hard to stay informed and make really good informed decisions, I think it's just human nature that anyone you're sitting across from will want to reach out and put in a bit more effort themselves, or help you more, or be more engaged. I think that's true. It's any time in life. If you see somebody trying really hard to be, I don't know, to try to become an athlete or excel in a sport, and you see how hard they're trying, you might want to help them get there. It's the same almost with your own health. If you turn up and you say to your doctor, if you have no idea what's going on or why you're taking your medications, what they're for, or what's happening. I work with patients like that all day, every day. But the patients who come informed, it's very easy for me. My job is really to help people get there, but it is much easier for me to help that patient get what they need, and it's much easier for me to help that patient know what to ask of their specialist or their medical doctor, and how they might want to phrase it or how they might want to present things if they've got that information on hand.
So that's actually another thing that a naturopath can assist people with in working cooperatively with their regular general practitioner, is to be able to help people in the type of language and things that will help them get information to their other medical practitioners who would be able to help with something that you have assisted in finding that might be an issue.
Yeah, that's a really big part of my job. With difficult cases where people haven't had a diagnosis, they're sick, it's 5 years, they still don't have a diagnosis, that would be an example of where that would be really useful. And with, with cancer patients as well, just knowing how to read your own blood work, or knowing which questions to ask your doctor. You got 10 minutes with your oncologist. It's nice to know if you want to have 10 quality minutes. Yeah. And if you go in and you get lost in the how upset you are at how much your quality of life has been affected, and you spend 8 minutes just describing how difficult your morning was. Let's just say that happens.
It can happen.
Which happens quite a bit. The oncologist won't be able to help you as much as they actually want to.
If you get 2 quality minutes instead of 10 quality minutes, there's a lot less time available for them to give you the quality of care, I guess.
And it's not just a frustration for the patient. It's also hard. I believe it's really hard on the oncologist as well, or your specialist. I think they want to do more, but it can be hard when there's a lack of information. So yeah, you're right. With seeing a naturopathic, I feel like a good naturopathic doctor who's practicing naturopathic medicine as we're trained to do, would always view empowerment as the cornerstone of treatment. That's addressing root cause directly. If you know why you're taking your medicines, and you know what they're doing, and what side effect and what isn't, or what a treatment's for, and what the pros and cons are, and what the risks are, or what questions you need to ask to feel comfortable with the procedure. I really do feel that there's healing in that before you do anything.
I would have to agree. I think one of the other things that certainly has had an impact on my own cancer treatment would be changes to lifestyle, most certainly. I could be wrong, but I certainly feel like my lifestyle choices, stress levels, that most certainly was a contributing factor to my cancer and probably its progression. I think if your body is under stress or if it's under duress, it is not in as good of a position to deal with any kind of an illness as when it's in a more optimal state. So if you are eating healthy, getting enough sleep, you are not constantly in an emotional state of turmoil, obviously your body would be able to respond to whatever stress that it has in a more positive way. So to be clear, I don't just take turkey tail mushrooms and chemotherapy and woo, we're all better. I have made conscious changes to the way that I think about things that would previously be stressful for me.
Right.
So, not only am I doing that, but I've also tried to incorporate things that are more positive mentally. So I'm in a better headspace to be able to deal with the bad days when I have them.
And and you seem to be tremendously good at that. Your attitude. I mean, when you come in the room, and we've got a room full of people who are really ill. I know you. There's a lot. I haven't ever been in your position, so I don't know exactly what it's like. But I can't imagine that it's easy. You come in the room, and there's a lot of other people, and I've seen this. You lift them up. So I find that interesting that some people seem to be able to be extremely positive on that journey when they're dealing with cancer, whatever stage or form it is. I have noticed over the last 10 years, and I've had the chance to meet a lot of people with who've had to deal with cancer, and it does seem that people, this is a loose,
Of course.
it's not a scientific.
It's a generalization.
It's a general. This is just something I've noticed. People who are really positive and happy, or change their life in such a way that they become more positive and happy after diagnosis, like when they make that change that you're talking about, they do seem to do better.
Yeah.
Those patients oftentimes will, there'll be a prognosis, and sometimes people will ask their oncologist, I don't think this is a great idea usually, but they might ask, how long might I have? And I really don't think that's a great idea, because I almost feel like sometimes people will actually put an X on the calendar, and I've almost seen that happen where they live to that date.
Yep.
They'll be doing great, and they can see something coming up a few weeks down the road, and
then it's like, time's up.
It's quite shocking when you see it happen. It's shocking because it doesn't make sense that somebody would deteriorate so rapidly.
Yeah.
But they're fixated on a date. But anyway, we know what there's always your oncologist will always know what the general timeline should be. I have noticed that people who are able to find that peaceful place that you talk about, that's mentally, spiritually, they seem to like really, if anybody beats, I should say, if anybody's going to beat expectations, I haven't seen an angry, resentful patient yet beat expectations, by double.
Yeah.
But frequently we see that happen. And frequently we see that happen with patients who are seemingly most positive.
How much of an impact do you think it has on your general health for people who have these influxes of cortisol and the stress hormones? What kind of an impact do these stressful... So when you're feeling stressed and when you're feeling upset and angry, it isn't just, a mental thing. There are actually hormones that are released in your body that put you into that fight or flight. Cortisol, adrenaline, a number of these different hormones. What kind of an impact does that have on the body and the health?
Okay, well, it's funny. I try to keep things
you can tell
on
me
point and focused.
If I'm crazy on that, but
well, no, you've got a point. I'm just going to try to articulate, because I think there's a short term and I think there's a long term effect of what you're talking about, and I think there's a few interesting things on that subject. I think if there's an audience there, if anybody's watching this, they're going to get annoyed because I'm about to quote or point out to studies that I can't remember the title of, and I can't remember the names of people. But
we will look up the studies later, and I will put it over here.
Okay, good. Yeah, it'll be on the wall here. Okay. Because in the short term, and it's not just getting angry. It's not just getting angry. It's also being stimulated. Being really excited is hard on the body. The brain doesn't know that it's, going on a roller coaster ride or jumping out of an airplane. That might be fun for some people. The brain still doesn't recognize the difference between this is a fun jumping out of the airplane and this was an accidental jumping out of the airplane. So cortisol and adrenaline and stress hormones are released for a variety of reasons, and they do all kinds of things on the body. And I think there's a certain amount of stress that's very healthy, and I think there's a certain amount of and then there's probably a point where it becomes unhealthy. And I think people know when they're in an unhealthy place. So this is just my own opinion, but in the short term, that high level of cortisol, we can always, if it's a once in a while thing, we might have a stressful day, cortisol is released, and you're able to do an incredible amount of work. Maybe you're short-staffed at work, or you have extra work on your shoulders, and that stress will help you get through it. And you can get through stressful events, and then you'll come down, and then you'll rest and come down from it. But if it becomes a habit that, that's how you get going every morning, is to tell yourself really stressful things or be really angry, and that helps you sort of wake up and be productive, and you're very resentful and very stressed and very upset. In the short term, I find that maybe in the medium term, if you're going through a stressful period, people start to seem to get colds and flus more often. They won't sleep well, which will cause usually a deterioration in their mental health. Mental health will usually it's more difficult to be emotionally stable if you're not getting enough sleep. And then we'll see damage to all kinds of systems. You can have problems with we are all aware of heart disease. Of course, blood pressure and things like that will be not in a great place. But there's an interesting study that, and I forget the name of it, and I think it's Harvard that started it, and it's about 80 or 90 years old, and they took all these, I think it's just baby boys, but they took a large number of baby boys at birth, and they recorded their names, and I think once a year they've checked in on them to see what they do and where they've gone and what their schools have been like, and they interview them, I think, on a yearly basis. It's a fairly famous study, and it should be on this wall at the end of this. But what's interesting is what we can see is, generally, if you're happy, your risk of disease and mortality is nearly halved. So your chances of developing really anything, cancer or heart disease or diabetes or having a stroke or recovering from any illness that comes along is much greater if you're happy. What's interesting is it seems to be if you're happy after 40. So you've kind of got up till 40 to, you can really abuse your system, and you can drink heavily, and you can get really angry, and you can do all those. I'm not advising to do these things, but it seems like you can make a lot of mistakes. And then at 40-ish, you need to sort of learn how to be okay with how things are and try not to be resentful and make peace with things. It's easy to say that. I think some personalities are able to do that more easily than others. I have, I know with my own self, I have trouble with those things. I have a very intense, people say I'm a very intense person. I don't feel that I am. But when I check my blood pressure, when I'm at work, it's always elevated, even when there's no one here. I seem to take things really seriously. I try really hard not to. I've been working really hard on it this last year because I don't want to get sick, and I do think that it is a cause of disease. It's not, being happy isn't going to make it so that you never get sick, and it doesn't mean you're never going to get ill. We've got people who are 19 years old who get lung cancer, who've never smoked or done anything wrong, and they're not really all that unhappy. And that, in life, I feel like it's like there's a lot of luck and bad luck, and
there's an element.
But even if you get some bad luck, having that positive attitude seems to correlate with better outcomes. And I'm not, when we talk on this subject, I am not the expert. I'm actually not really. I don't feel like I have very good skills in this area at all. But that's a complex place, and that those personal journeys can be very difficult to step into. Being different is scary. And there's a lot of fear, and there can be some real blocks mentally to even when we know we need to change. And I personally have had trouble with that. And I know that I would, with my patients and as a naturopathic doctor, always looking for root cause of disease. And oftentimes it's traumatic events in people's lives that have deeply scarred them. And there's no amount of any supplement or anything that I can really, and I really struggle with those patients. And there's quite a few. We're cerebral beings. We're much more mental, I feel like, or spiritual than we are physical. And when that's offline, we see the illness physically for sure. But I'm starting to ramble again. But I don't know this. I would urge people to find solutions in that area, and I can help people find. I often refer there.
Yeah.
But
something that I often say, when I'm discussing this particular thing with people, is for starters, I would consider myself to be one of the most positive people that I know. I think you would probably agree with that assessment. That generally speaking, when I encounter difficulty, I will try to find some element of that would make it a learning experience as opposed to just a traumatic experience.
I would say that you're, you would see you're probably the most positive person that I've met. Mm-hmm. And I have known you as a patient, not just as a friend. Mm-hmm. And I would say in that context, as a patient, just when we're in a confidential setting, mm-hmm. your ability to adapt that way is unusual. It's uncommon.
Yeah. I guess my thinking on that and what I try to keep in my head is that we all have, whether you have cancer like myself or whether you are completely healthy and physically active and doing the things that you need to do, we all have X number of days that we are going to be here for. Mm-hmm. And there's a couple of things that come into play here. Number one is there is a very large difference between living and being alive. There are a lot of people who just go from day to day just living. They wake up, they have the same shower they have every day, they have the same cup of coffee they have every day, they drive to work the same as they do every day, they do the same job the same way. And the majority of those things do not involve any thought or engagement or any mental being there. Mm-hmm. And to me, that's just living. For myself, I very much try to experience as much of my day as I can. So, when I wake up, I don't just do the same thing every day. I actually try to experience what's going on. If I'm having a cup of coffee, I want to experience, the aroma of that coffee, the flavor, the warmth of the cup. Experience mm-hmm. every part of that experience. Mm-hmm. It's not just a cup of coffee,
Right.
It's this sensory experience. And I find that the more I am able to do that, the more complete and fulfilling I find my days. Mm-hmm. It's if you give your wife a hug, experience, don't just give them a hug. Feel the warmth, mm-hmm. Feel the other person breathe. Mm-hmm. It's a connection. It's a sharing of something. It's not just giving a hug. Right.
What about the negative things? Like I've noticed that it's one thing to be present for you're enjoying a cup of coffee or hugging someone you love, but when something hard happens and it's upsetting, I've also noticed that, and this is just me, that if I allow myself to feel that pain, which isn't comfortable,
yes,
but I do know how to shut those things out, and that would be the habit.
Yeah,
that would be what your non-living thing you talk about.
Yes.
I've learned how to shelve emotions at times, and then of course they build up, and then it gets really uncomfortable to let them come out. But if you feel upset when it comes, and really feel it, think about what you're feeling mm-hmm. as an experience.
Yes.
Do you do that as well? I'm just curious because you talk about the positive so much,
I do. Yeah.
But as people, we do experience negative
It's a part
experience.
of life.
Like we have both.
Yeah. What I have discovered is that fear is something that really limits us very, very much. So people are afraid of pain. They're afraid of discomfort. They're afraid of embarrassment. They're afraid of all of these experiences in life. Everything that exists in our life has two halves to it. So, every happy has a sad. Every positive has, a negative thing that can also happen. And people are afraid of these things, and in being afraid, they avoid them. So, if you've got a job interview coming up, people are afraid of what questions they're going to ask. Am I going to look silly in this interview? People like myself who have an illness, cancer has a lot of pain associated with it. It isn't, I don't talk about it a whole lot, but the fact of the matter is there are, many days where I have fairly intense, sharp, stabby pains. And what I've sort of discovered in the process of that is that there's two things that people tend to do with that. They tend to be afraid of the pain, so the worry about that pain or the thinking about the pain you felt yesterday, your brain doesn't really know the difference between what you experience physically and what you replay in your head, or what you play as scenarios in your head. So, if I were to think about the sharp, stabby pain I had yesterday, and I really paid attention to that pain that I had yesterday, then the thinking about that today would produce the same physiological reactions as having that pain yesterday. So, getting back again to we have a limited number of days available to us, no matter who we are. By not shying away from the discomfort that I feel, and instead embracing it, leaning into the pain is what I would call that. So instead of moving away from it, I move towards it. Then I will experience that discomfort once, and having experienced it, I can more easily put my attention and consciousness to other things.
Well,
So
you can experience the next thing.
I can experience
You can leave
the
that
next
pain yesterday.
Yes.
And be here now.
Exactly so. So I'm not going to be worried about, am I going to have another pain this afternoon? Was that pain yesterday something horrible that's going to, kill me tomorrow? Instead of spending the time that I have available focusing on that, I experience it, I deal with it, I move on to something else, and I can leave that behind.
Right.
And in leaving it behind and experiencing what I'm experiencing now, which is not an unpleasant thing, I'm able to let go of the negative and focus on having the positive experience that I'm having now.
That's good, Thomas. You've been able to do that. A lot of people struggle. They even, there's a lot of self-help books out there, and that sort of give those
I'm gonna have to read one of those someday.
Yeah, maybe you'll write the one that actually works. Yeah, but a lot of people read those books and listen to podcasts, and they know what they need to do, and that's where I find it challenging. I think really when it comes down to it, it's actually a certain amount of courage is required. To live fully, to be alive, requires courage to to do what you know is right for you, to experience what you're going through, and to be honest with yourself. I think that actually takes a lot of courage. And so when we talk about fear, I mean, it has to be something scary for you to be able to be courageous. I think fear does block us from being able to
so much
to be here. Yeah, and that's really prevalent. Yeah, that's an interesting topic, and
I wasn't always like this. I wasn't born this way.
When did you change? When did you learn?
I have made conscious decisions over the course of probably, I've been very positive for probably the past 10 years. I had a job that I found to be fairly stressful. I was working management at that time, and before I had developed any of these skills that I have now. Probably about 10 years ago, I made the conscious decision to remove things from my life that I knew were having an unhealthy, stressful impact on me. So the first thing I did was change jobs and move into something that I still enjoyed and was still good at, but didn't have as many of the elements of things that weren't healthy for me.
Yeah, the things that you didn't really enjoy, or
and a lot of that was the management end of it. I really enjoy hands-on, frontline interacting with people and getting a result out of what I'm doing, as opposed to delegating work off to a lot of people and having them do it. Not as satisfying to me. So I took a very hard look at the things that I liked and that were positive and were having a good impact on my life, and the things that were having a negative impact.
Right.
And it's really not rocket science. If you remove the things from your life that are having a more negative impact while retaining the things that you find wholesome and supportive, then you will naturally have more of that. And that is kind of a first step.
Okay, but you're talking about that first step like it's...
Like a nothing?
Yeah, it's not rocket science, and it's easy, but
all you do is just change your job and your lifestyle.
But this is what I've found interesting in my practice, because again, I'm always looking for the root cause of illness. What makes you happy? That I don't know that people understand what it is that makes them happy. I would say, at least of my patients, who are the people I'm most familiar with, which is probably a subpopulation. But I think people are people. We don't know what makes us happy. So when you go through someone's life and say, when were you your happiest? I think that's a really good, to make note of the days, like when you're saying, just do what makes you happy. I think it's important to make note of the days in which you're happiest.
Yes.
And then reflect on what all of those days have in common, and the days you're least happy, and what do those days have in common? Because what we tend to find is that, when I think I've probably sat with, I don't know, like thousands of people, and I ask almost all my patients, what makes you happy? And the answer is always the same. Have I told you this before? I don't know if I've told you this. Have. It's always the same. I've never had a patient tell me a different answer to what makes them happy. And the answer is always the same. So if I ask somebody, it'll always be the exact same thing. Spending time with friends and family, doing the things I enjoy doing. And having meaningful work.
Yes.
That is another thing that comes up. The first part's most of it usually, but oftentimes somebody will say, it's important to me that my work is meaningful. But the most important thing is always spending time with friends and family, doing the things that I love doing, and then that meaningful work.
Yeah.
And
there's an interesting thing that I was listening to an Alan Watts lecture the other day regarding work.
Okay.
And he had an interesting point in there that I think is valid, and that would be the difference between a job and a vocation, is how he was phrasing it.
Mm-hmm.
So there are many things that people do for money, and a job would be something that you do for money. So
Right.
that is the desirable end result of what you're doing is money.
Yeah, I need money, so I'm going to do this job to get the money.
Yes.
Right.
Now, there are all kinds of jobs that are unpleasant, and we will pay somebody to do those jobs. Somebody's going to clean out the sewer. Somebody is going to collect the garbage. Somebody's going to clean out the drain in your house. So there are a lot of jobs that people don't necessarily want to do, and there are some jobs that you don't want to do, but somebody else will find rewarding and fulfilling. The fact is that we are all different animals, but if you are doing a job for money, that is the least fulfilling thing that there is. Money is literally the least fulfilling and motivating thing in the world. Now, the money, it can allow you to do other things, but the money in itself does not give you personal satisfaction and gratification. What is probably most helpful is if you can look for something that does give you that personal gratification and fulfillment, and parlay that into a vocation. So you should, if you are not filling your days with things that are gratifying, personally rewarding, fulfilling, working towards something that you feel makes a difference either for you or for those around you, then you're doing a job, not a vocation.
Not a vocation. And sometimes we need to.
We need money to live.
Yeah,
That's
and
a fact of our society. You have to pay for a roof over your head. You need to pay for food. So unless you are, living on an acreage or a farm and you are producing your own food and your own energy off the grid,
right,
you need something for money.
But even then, you've got to.
There are options.
Well, even then, you're out there working and growing your food and working the land. So there's always some aspect of a job. But the happiness can be attained even if you have to do a job.
Yes.
And so that's interesting to me. So when you say focus on those things, I think it's important for people to figure out how to do that because it's really elusive. The number of times I used to work down in a very oil-rich area, and a lot of my patients were there, I guess, for the money. And I remember people talking to me about how unhappy they were. And this is a bit silly, and I don't do it anymore if it comes up, but some patients would tell me about how many hours they have to work, and just to make up a story, totally make this up. If this sounds like you and you're a patient of mine, I have totally just made this up, and it's a coincidence.
It's not you.
It's not you. But somebody might say...
It's probably a story about me, I'm sure.
Yeah, but they'd say... I'd say, why are you working so much? It's like, well, I've got bills. I've got to work an 80-hour week. Well, what are your bills? Well, I've got a... This is right after someone says, fishing with my kids is what makes me happy. Being around my kids, fishing with my kids. They list all these other things that make them happy. It wasn't necessarily their job.
Yeah.
They're doing the job for money, but they really like fishing with their kids, and they're working an 80-hour week. So of course they're not fishing with their kids at all. Yeah. But I'd say, what are the bills? And they say, well, I've got a very expensive, beautiful home with many, many rooms and many spots for cars in the garage.
Sure, I've got a $100,000 boat that I'm going to be fishing
and $100,000 boat was another one that you could fish or surf behind maybe.
Oh yeah.
And then of course the vehicle, a brand new vehicle that's
to pull the boat,
to pull it that's strong enough, and then a cabin,
someplace to put
to
the boat.
put the boat when you get to the water, and all of those things cost. And the person would have just said to me, like, fishing with my kid on the weekends is like, that's heaven. That is really when I'm truly happy. And that's my passion. That's everything to me. And I'd say, well, why don't you do it? Well, I have to work 80-hour a week to pay for everything. And I'd say, well, I don't do this anymore, as I learned that this is how you lose patients quickly. And in private practice, you try to keep people and work within their own belief structures and things like that. But I'd say to them, why don't you downsize your house and get an ordinary 1950s house that's been cleaned up and that's got trees around it or something that's near your work, and then you wouldn't have to commute very much, so that'd save some time, and then you wouldn't have all those mortgage payments, and then you could get a secondhand truck that was a fifth the price, and you could just get a small fishing boat that doesn't have the surf option, and then you could rent a cabin. Mm-hmm. Every second weekend all summer, and that would be way less expensive than owning and maintaining a cabin. And they'd look at me like I was crazy. Mm-hmm. Yeah. Actually look at me like I was brain damaged, that I would make such a suggestion that there's something must be really off in me, that I would suggest to them that they didn't need a brand new F-350, that they didn't need a cabin, that they didn't need a surf boat, that they didn't need a huge home and a perfect lawn and all those things, because they know that a good person has those things. Mm-hmm. And I'm using this as an extreme example, but we're all, I think most people are actually fall into this trap somewhere in their lives when you look. There's a very common trap to fall into. It may not be what I just drew. It might be you have a shop that has very high rent, like a high overhead, or so you feel like you need that. Yeah. You need to come up with that money, but you maybe in your heart of hearts, you don't need to have that fancy location. Or we put ourselves into a position where we're not able to do the things that actually make us happy, and it can feel very uncomfortable. And this is where I think you're actually more different than you point out you've done these things and that.
Yes.
But where I think your unusual ability is you're able to be very rational and very clearly see, I don't need these things. They're making me unhappy. Mm-hmm. I got rid of my car a couple of years ago. Because I knew that if I rode my bike all winter, I'd be happier. But it gets cold here. It's minus 25 or minus 35 with wind in the winter, and that's Celsius. And so it's uncomfortable at first because you don't know how to dress. So every time it would be 20 below, I'd get in the car. So I got rid of the car. It saved me a bunch of money that I could put into my health, and it would make me ride my bike. So I know I don't need the car.
Yes.
I know that. And I know that it makes me sick to use the car to get to work. It's kind of like a wheelchair almost. Mm-hmm. And I don't need it, and I need the exercise. I know that. But when that car pulled away, you know that feeling you get when you're 16 and you get your first car?
Yeah. It's the
opposite feeling of that. And even though that, like, I have my wife's car that I can use anytime, it hurt.
Yeah.
It felt wrong. It was really hard to do. It was really hard, and I'm not a stuff person. No, I'm not a materialist. I don't see. I'm not a stuff guy. Mm-hmm. But when I saw that car leaving, it was a psychological impact that it had on me, and I think that we all are irrational somehow. I think hardwired almost.
Yeah. Tell me if I'm wrong on this one, because my feeling on that has kind of been that we have been programmed by media and the retail and people around us to associate our happiness with a thing. Mm-hmm. Like if you get this box of Kleenex, this will make you happy.
Right. So
This
now
will
you're
give you
happy and I'm
fulfillment.
angry.
Yeah.
Yeah, like that.
And things like our cars, our homes, our possessions, we attach these feelings to because we believe that if I just have this new phone, it's going to make me happy, and my friends will be so jealous of it, and people will associate a status or a stature with me because I've got this new iPhone 2000, but when you actually have these things, you realize that they're useful and they serve a purpose, but my phone doesn't make me either happy or sad. Phoning people with my phone can affect my feelings. But
How
the
you
phone
choose
itself
to
doesn't.
how you choose to use that phone is what determines
Yeah.
your happiness.
So
Yeah.
I don't feel personal happiness or gratification or satisfaction by having the brand new car, for example. It doesn't really do anything for me. It serves a purpose. And I focus my attention on the things that I recognize actually do have these impacts on me. So, a new car doesn't make me feel good, but because I have a used car, I have paid cash for. I don't need to have that same level of income to make car payments for a new car. That isn't making me happy anyways. So
you have more time with your family, doing the things you enjoy doing.
exactly so. And identifying the things that actually make you happy is something that I think everybody should do. It is, again, one of those introspective processes. I think we really need to spend more time actually looking and listening on the inside to see what kind of chatter is actually happening, what kind of conversations are going on inside of your head. A lot of people really just don't listen to it. So they have these feelings of stress or depression or anxiety, and they don't know where they're coming from. Knowing where it's coming from doesn't necessarily eliminate it, but it gives you a direction to focus your energies on where you can make these improvements. So I am sure...
And have the courage to do it. Sometimes it's really scary. If you have spent your whole... If you're, nearly 40 years old and you spent the last 20 some years trying to get into the right neighborhood and have the right house and the right husband or the right wife, and you've got the right number of children and the right types of cars that are the right colors, and your kids are at the right schools, and you belong to the right clubs, and you have a cabin on the right place, and you realize that you're very lost and sad and unhappy and needing to take drugs, to medications to not be anxious and depressed. If you realize, like, gosh, I'm much happier when I'm doing things that aren't what all of the right, good people, whatever that is, what everyone else is doing. If I don't do what everyone else is doing, sometimes that's where I'm happiest, when I'm by myself, whatever it is, just doing some hobby that's not trendy, or hanging out with people who aren't the right people, or whatever. If you do what you know is right in you, if you spent that many years trying to be a good person and have all the right things, and you've really worked so hard for that, that's where I make my mistake when I point it out to that other patient or those other patients, because you don't realize how much that person's invested. You're not acknowledging how much they've invested in getting into that, getting into the place where they are. And it takes courage.
It's their identity.
To a degree, it is. And then it's like, well, who am I if I step away from all of these things? That, it's not as dramatic a change as sometimes as you would think. We discovered this year during the pandemic how valuable social time is. We just, one weekend I had 3 different people visit us, which has been extremely rare this year. And I remember at the end of the weekend, the whole family, we were happy. And I said to my wife, what's different about this weekend?
Yeah.
And the only thing that was different was we'd had visitors come.
Mm-hmm.
Just people, not any particular special visit.
Yeah.
Just people came, and we shared stories with people, and we worked together. We did a little bit of work together, not just play.
Yeah.
But they helped us fix some things.
Mm-hmm.
And
you actually produced something that was useful and satisfying and gratifying to have spent time with somebody doing that thing.
Meaningful together. Yeah. And so if you said to your friend, hey, do you want to come and help me like reshingle part of my roof this weekend, you'd think, that doesn't sound like fun. It sounds like work to me.
Yeah, yeah.
But actually, at the end of the day, when you're sitting down and having a beer and
yep.
you actually, there is a level of happiness.
Yes.
But we don't put a value on that.
Mm-hmm.
Yeah, anyways.
That is exactly the point. That is exactly the point that I'm making, is we don't pay enough attention to those things that we recognize are things that give us personal satisfaction and happiness, in the same way that we don't pay attention and recognize the things that are doing the opposite of that. Mm-hmm. So again, that comes back to that idea of the difference between living and being alive. A lot of people are just living, and they go through their day, and they go to work, and they come home, and they feel miserable, but they never put any thought into, why do I feel miserable? Mm-hmm. What are the things that are actually making me feel miserable? Mm-hmm. In the same way that they don't pay attention to the things that make them happy. Life just sort of happens to them, mm-hmm. but they haven't been really engaged in the process. Mm-hmm. And the more you engage in it, the more you can come to understand the things that really give you that personal satisfaction and happiness. And if you put your energy into those things, and you take your energy out of the things that are not doing that, mm-hmm. it can be as simple as just a slight shift. It has a cumulative effect. So if you are constantly doing things that wear you out and burn you out, that's what you're going to get. But if you lessen that and you increase the things that are energizing and recharging, the balance will shift. The more the balance shifts, the easier it is to stay engaged and focused on the things that are having a more positive impact on your life. When you talk about courage, courage I have found is something that is also something that you can level up on, I guess, if you want to use gaming terms.
Level up on.
So start with little things, little victories. I have certainly had times in my life when I have been so depressed that I can't even get out of bed. I'm no different from anybody else. I have had those days. And your courage starts on days like that. It is something small and simple, like I got out of bed and I had a shower today. I got out of bed and I did a load of laundry. It starts with little things like that. And you build on it. So I accomplished that yesterday. I felt good about it. I'm going to try something else today because I know I can. I did it yesterday. I did a thing. So maybe today I am going to go and pick up a few groceries. But it is looking at things that I don't feel like doing that, but I know that it will give me a sense of accomplishment. And you just push yourself. You lean into it. And that's that concept of leaning into the discomfort or leaning into the thing that you're avoiding. And by actually doing things, it will give you the confidence that you can and I can try something else. So you start small, and then you accumulate things. And before you know it, the things that are uncomfortable that you're dealing with is larger and more significant in your life. You know, I am going to talk to my spouse about, if they do something that you don't like or you find embarrassing, or whatever the case may be. You work your way up into having the courage to do more uncomfortable things. And as you accomplish these more uncomfortable things, you become more comfortable with what you are capable of doing. So, I mean, right now I am at a state where I feel comfortable walking into an operating room for surgeries and things like that, quite frankly, would be in previous parts of my life unthinkable.
Right.
In terms of the anxiety that would be associated with something like that. But I've worked myself, little courageous things lead to bigger courageous things. The more you stretch yourself, courage is like a muscle. You exercise it, you become better at it, it becomes easier and more acceptable.
Well, it sounds like, so a few things there. There's two parts of the equation. Focus on the things you're happy, that make you happy.
And put your energy there.
But recognize there are things that make you unhappy.
Yes.
I actually haven't given that a lot of thought. I haven't thought about that really very much at all, so that'll be my next project for this year. But it also sounds like you're saying, what you're talking about sounds like everything that you're focusing on is within your control to things that you can work with yourself. These aren't things that you're hoping for or hoping others will do or praying that the world will be different or you're actually focusing on things that are firmly within your circle of control.
And it's very important because nobody is going to make you happy. The same as nobody is going to make you sad. Nobody makes you angry.
Right.
Nobody makes you anything. You do. And it's completely the way that you interpret and respond to events in your life. And what, you get into a fender bender or something like that. You are completely in control about how you feel about that situation and how you are going to interact with the other person. That's all within your control.
And recognizing that is your choice.
It is, yeah.
How you decide to deal with the problem is all your choice.
It is.
There's a lot of autopilot going on.
There's a lot of autopilot.
Yeah.
That's that living and being alive. So, if you're on autopilot, you're living, but you're not really engaged in the process of being alive.
Yeah, I think that's true. I find it quite hard to remain out of. I find autopilot kicks in when I'm fatigued.
Yeah,
it's hard to stay fully conscious when I'm very tired. What
most people don't really acknowledge is that most of what you do in a day is autopilot. Most of it. So babies and children, they're not in autopilot because everything that they experience is new and interesting and different, and how does this work and why. So, kids and babies are much more involved in this process of being actively alive than we are. Because, you've had 1,000 showers in your lifetime. You don't have to think about it when you're doing it. You're thinking about other stuff.
You'd be better off if you did.
Yeah.
But we don't. We're thinking about work while we're in there, and
you're engaged in other things.
You're doing something else somewhere else.
Yeah.
That's true. I think it's why kids have make such profound statements at times, because they're actually
they're more engaged.
More engaged, and everything's new, so they can see options you're no longer aware of.
You're not even looking at.
Yeah.
You don't even see it. And the more you can become engaged and active in the process of being alive, you will find that you will become more creative and happy, and things will appear more obvious to you because you're actually seeing them.
Yeah, well, it's something to work on. Yeah, and I think there's a lot of people out there who would benefit from what you're suggesting. And when it comes to that journey with cancer, when you're facing oftentimes your own mortality, that need for courage and it seems to come to the fore. I think all of us, it's a funny thing, right? Like, you know, I could be riding my bike home today and get smoked by a bus. I use that analogy a lot, and I think I probably should stop because it's probably draw that to me or something. But I could get smoked by a bus and get completely smushed and snuffed out. And it's funny because, you know, it's somebody who's dealing with sort of a semi-chronic, like a condition where they've got cancer and it's threatening their life, but the journey can be years and years long, and you may overcome it.
Yep.
A lot of people do. Most people do. But so even if you've got something that's small, like a little, you know, a cancer that's easily dealt with, that mortality is it does come to mind. You're not invincible. When at least I seem to notice that patients go through what you're discussing, and it seems like it pushes. You have a choice almost to go into denial or into panic and or get angry at God, or you know, you can take something like you've been forced into looking at dealing with this cancer, and that's a full-time job. You've shown that
it is.
But you're also you're making the effort to ensure that every positive thing that you've learned along the way is available to anyone. You're and I'm sure that there's meaning in that. Does that bring you some satisfaction?
Honestly, it does. You know, I'm on camera right now, and not everybody's comfortable with that. You know, there are lots of other people out there who have had success with their own cancer journey in the same way that I am having some success with mine. I'm certainly not the only positive person out there. I think it's a little less common for people with what they call a terminal illness to be as positive and upbeat as I am. But again, everybody has X number of days left, and our attitudes and perceptions of what we experience during those days will make us feel that that day was either a good day or not a good day. The exact same day, same circumstances, but interpreted in two different ways will either make you feel more positive and fulfilled or feel drained and run down. And I try to take even the negative parts of my days and treat them as something that I can learn from and carry forward a positive thing even from a negative day. So if I can get something of value, then that wasn't a wasted day. You know, I have a day where I have chemotherapy. Okay, well, I'm on chemotherapy. I am taking medications to deal with the side effects of that. I'm definitely going to be in bed all day. So, you know, what's your positive you can take out of something like that? Well, I try to spend as much of that time meditating as I can. Or, you know, if I'm going to be stuck in bed and I'm not fast asleep, then maybe I'm going to be watching an interesting video on something that I will learn a skill from, or learn something new about, or a new treatment. maybe there is some sort of a new exercise program that I might try in the week after I finish my regime. So I'm thinking about things that I can get from it, as opposed to sitting there and thinking about how bad I feel. So I have discovered with meditation and my experience with psilocybin that I'm probably not going to cover today, but we can cover another time. I've discovered that your consciousness will go places and focus on things that you're paying attention to. So if I were to have my chemotherapy and I am thinking about the pain that I'm having in my intestines and I'm focused on that, then that's where my consciousness and attention is going to be. Thinking about the pain, focusing on the pain. That hurts. Does it hurt more than it hurt a couple of minutes ago? No. Is that getting worse? Is that still there? If you dwell on these things, of course they're going to... Your brain has circuits in it. The circuits that fire the most often are going to be the strongest. It's like exercising a muscle. So if I am constantly focused and thinking about pain and discomfort and unhappiness, then I'm going to get really good at it. Now, if I acknowledge the pain as a thing, recognize it, okay, but that's not the most important part of my day. The most important part of my day is the rest and healing. So I'm going to focus my attention on trying to heal, work through the symptoms, let them go. That's great. I acknowledge that that was there, but I am focusing on the things that I know are going to have a good impact, not a negative impact. So I'm strengthening those neurological processes which are focusing on the more positive. So,
and then it becomes easier and easier for you to
let
be
go
positive
of discomfort.
The more you work at it.
Yes. Yeah. So
and easier and easier to be more comfortable when you're
easier to let go of discomfort, let go of the pain, and that is a growing process. Again, start small. Start with a little thing, a little accomplishment. Prove to yourself that you can do it. And then once you know that you can, stretch it a little bit. Push your comfort zones in terms of what you are willing to try.
Yeah, I think that's really good advice for all of us. Not just if you have
terminal illness.
A terminal illness. And I think that's true, because you only get so many days, as you say.
You get to pick whether they suck or whether they're good. You get to pick.
Yeah, and the more sucky days you have, the more sucky days other people have to deal with generally. The people you live with and work with will feel.
And the more sucky days you have, you start to expect to have sucky days.
Yeah.
And once you start to expect to have a sucky day, I guarantee you're going to have a sucky day. I expect to have good days. Yeah. That's my expectation when I wake up. I expect I'm going to have a decent day. And I expect that I'm going to be successful at the things that I really want to accomplish. Generally, that's true.
Right on. That's great, Thomas.
So this has been, for me, a really fun conversation with you. Hopefully there are some other people out there who maybe have seen some benefit out of it or have gotten more than nothing out of it. That's kind of the way that, I hope to... the way I work with my positivity is you hope for the best, you put your efforts into that direction, and you look for the outcome. For our chat today, I was really hoping that we'd be able to cover some of our topics, and I feel like we've covered quite a few things that I find interesting anyways.
I think we covered some really interesting topics, and thank you, Thomas. Thanks for having me, and
thank you.
Thanks for listening.
You have an excellent day, everybody.